Good afternoon. This is Vesna, the Director of Patient Services for Blue Parasol Infusion, showing you an educational video on how to use the Curlin 6000. You may encounter this pump or either the Curlin 4000. Either way, both pumps function the same way. So we're going to begin first by using an antimicrobial to wash our hands, or you can wash your hands in the home setting. Okay, this technique is a clean technique. It does not require gloves. However, if you feel comfortable wearing gloves, you may do so. Okay, and now the next step is going to be to take our pump and turn it on. While it's turning on, it's going to be doing a series of checks. You may hear a couple of beeps during the process. You can now grab the saline bag or the medication bag and attach the tubing to the bag. Normally our bag should have a little blue cap, but right now, since it's an educational video, we don't have a blue cap. So we're going to take out the tubing from the packaging. Notice on the tubing there is a yellow cap and also an electric blue cap. That's what's going to be going inside the pump. Before placing the yellow cap into the pump, you need to remove the disposable clip, the safety clip that's attached, by twisting it off. Okay, now once there, you will prompt your pump upwards, and you'll notice inside the pump there are two arrows. A yellow arrow, which would be for the yellow cap that's on the tubing, and then on the other side, a blue arrow that will require the electric blue cap from going in. We're just gonna go ahead and push that in. Sometimes it's good to hold it in with one finger and then the other one. In this process, you wanna notice that the pump has a little gap. That is where you're gonna be running the tubing to avoid kinks. Once you're done, press down and close. So right here, this pump is not closed properly. So that means that the yellow cap is still sticking up. So we're gonna go ahead and lift it up again, push that cap in, perfect. And now we know we're completely closed. Okay. Before hitting anything else, we're gonna go ahead and remove now the spike cap from the tubing. And we're going to spike our non-sterile medication bag. It's always best to use a push and turn at the same time because you wanna get it all the way to that line there. Okay, perfect. So we're gonna set our medication bag down, and now we're gonna go and pay our attention to the keypad of the pump. So if we press any button, it should allow us to resume activity. Okay, you only have two options here in the menu. The library is currently empty. Every pump is like that, so no matter what, you're always gonna hit enter for program, which is the yes button. Here is either repeat RX or new program. We don't have access for new program because you would have to need the code for the pump. So we're always going to select repeat RX, which means repeat the orders that are already programmed into the pump. So we're gonna go ahead and press enter. This pump has a continuous and variable part. We don't usually see this from the pharmacy pumps, but being that this is an educational pump, it has that option. So we're gonna bypass it and just press enter. And this would be the next screen after repeat RX. It's going to do a series of self-checks. It tells you the bag volume, the rate, how long it will take, and the KVO rate. If you need to run by again and see what exactly are the orders again, you would hit no to review. Or let's say if you're doing an IVIG and you need to change the rate, you would still go no to review. In this screen, we're just gonna go ahead and press enter until we reach the rate screen. Okay, and see, now we're on the bag volume. Here you can change the volume, or in this case, we're gonna change the rate. So we're gonna hit enter until we hit rate. Right now it's currently set at 75. Let's start him off at 30 mLs. And we press enter. And we press enter until we hit done. Yes. Okay, so after this part, we need to prime the tubing that currently has air. And how do we do that? We're gonna just follow the instructions on the screen where it says prime. You're gonna hit prime. And here it tells you that you have to hold prime to prime the tubing. So we're gonna go ahead and hold prime. And we see the saline running through. Okay. If you've noticed, we never took off the cap from the tubing because we don't need to. It's always good to leave it on until we're ready to connect to the patient. Some of these IV tubings have filters, some don't. It all depends on the therapy and the pump. We want to stop when we see 1 or 2 drops come out of the IV tubing. Okay, perfect. After that's all done, we're going to go ahead and hit yes to exit. And at this point, we would hit run to start. And there we're going. So let's stop the pump now, pause. And in this screen, let's say the patient needed to use the bathroom, you would disconnect them and let them go, and then you would just hit yes to resume again. And run to start. And that's that. So let's go ahead and pause it and turn it off. Always have to pause before turning it off. Okay, if you ever need to know how to change the batteries, on the back you have a lock and unlock position. This requires double C batteries and they come from pharmacy. And that's all. Thank you.